also,
Yeah, there are multiple problems here. I mentioned that a product under emergency use authorization or interim order can't be mandated. That's a big problem, right? So these mandates never should have gotten off the ground to begin with, and that's why we're seeing legal challenges to them. And I can talk more about that in a minute. Secondly, we have in Ontario anyway, and I think you've mentioned before that there's a Quebec equivalent of this, but we have a sort of a Personal Health Information Protection Act. Mm-hmm. And one of the stipulations of that act is that your personal health information cannot be released without your consent. So vaccine mandates and vaccine passports really can't proceed without a violation of your personal health information, unless you are willing to give it up voluntarily, right? And that's a totally different story. I don't think that, myself, members of the CCCA, we're not saying that people shouldn't have a right to have access to these injections. But it would be just like deciding voluntarily to participate in any other drug trial. What we're objecting to, the worry here, is imposing it on citizens, especially when they don't have full information that would constitute informed consent, right? So a violation of the Personal Health Information Protection Act is a huge problem. Also, we have a right to refuse as Canadians any medical intervention, right? Yeah. And so you can't have both, right? You can't have some version of forced vaccination on the one hand and an upholding of that right to bodily autonomy and a right to refuse some kind of medical intervention, right? And we, for a long time in Canada, we have, in some sense, the whole field of bioethics is built on the idea that a person's body is his or her private property. Yeah. And, the abortion debate, the debate about end of life has focused largely on this idea and this kind of moniker, my body, my choice. Mm-hmm. And I think, Canadian law, civil discourse in Canada, medicine, bioethics has all been built over the last 20 or 30 years on this fundamental idea that unless there is some very high evidentiary threshold that some intervention meets, a person should be allowed to do with his or her own body what that person feels is right, And someone might say, watching that, well, this is a bit tricky when it comes to public health, because when we're talking about a communicable illness, what you do with your body does affect what I do with my body. But when it comes to the vaccine mandate and vaccine passport issue, if you choose to be vaccinated and that's your choice, you're protected. And it shouldn't matter what anyone else in your vicinity is doing from an immunological point of view. If you choose to remain unvaccinated because you feel that you have good natural or good T-cell immunity, then you're protected. And you don't need to know the immune status of anyone else. So vaccine passports, or what we were seeing, I think it was at the Vancouver airport earlier this week, that we had vaccinated and unvaccinated lines, which I think has been rescinded now, if I read correctly. But anyway, that was in place, right? It's unfounded from a scientific, immunological, legal, and ethical point of view. It's unnecessary. It's also costly to impose these, managerial changes, and they're unnecessary, unfounded.
And also, I know that the airport, international airport, Pearson Airport in Toronto, they said that they're ready to impose that also, two kind of lines, one for the vaccinated and other one for the unvaccinated. That's the beginning of a show me your papers society, like I said, and it's a kind of a communist country. And the data and the statistics are on our side. When I'm saying that, it's, they are forcing now in Quebec young people to under 18 years old to have the 2 doses, when we know with the statistic here in Canada that, if they have COVID-19, they won't die. The statistic is very clear. They won't die from that. And they have more chances of dying from the traditional flu season than COVID-19. And they're pushing the